I'm Sandeep Juneja. I lead the access function at TB Alliance. I'm thrilled that we are unveiling FastTrack the Cure 2.0, which not too long ago was a pilot as was an experiment launched just a couple of years ago. And that initiative, along with several other initiatives by TB Alliance and many other partners, have led to, as Derek said, perhaps the fastest ever rollout of a new TB treatment in recent times. And not only was introduction of Pretomanid fast, but it was also perhaps the most comprehensive ever executed by a single organization in recent time, of course, along with many other partners in the global health space. So at the outset, right in the market research stage, when you're introducing anything new in the world, whether it's a for-profit or non-profit sector, you do market research to see what the field wants, how you should go about doing things. And this was even before Pretomanid was approved. We consulted extensively with a wide range of stakeholders, including, very importantly, the communities, a constituency that many of you in this webinar today represent. And a clear feedback we received was to prioritize and invest in access. Um, and which really set us on the path that we took, and we did listen and we did invest in projects, time, effort, resources to stimulate the use of the treatment. Several access projects launched over the last 5 years since the first regulatory approval of Pretomanid. And the first one was LiftTB that helped generate local evidence for initial implementation. Then there was SlashTB to support decision making for implementation. So these were really projects that help set the stage, but and generate field evidence. But right after that, when we got going into implementation stage, we began working with communities once again after the initial information gathering and guidance. And the first effort of the Fast Track the Cure, the way it is known today, was in the Philippines, which led to Fast Track the Cure, the way you see it today. And it was how to involve communities into informing implementation. Uh, and several other projects followed from that, which I won't get into given the limited time we have today. But this is what I just wanted to highlight to the participants of this webinar today, how crucial has been community engagement right from the stage of thinking about how to bring BPAL, BPAL-M, and Pretomanid to the field, and then right at the beginning of implementation and scale up. The result of this comprehensive effort with multiple initiatives that I showed on the previous slide has been perhaps what I was saying earlier, the fastest ever uptake of a new TB treatment. It's been up to 10 times faster than what we had seen in the past. And it allowed us to achieve scale for the new drug, Pretomanid, much faster than in the past. And with higher volumes of manufacturing, with scale, comes the possibility of reducing costs. The cost follows very rapidly when the volumes go up. And this is what happened. The cost and hence the price of Pretomanid began coming down. And that aided with a similar dynamic that was playing out for bedaquiline, made BPAL, BPAL-M regimens cheaper. And you can see these green downward arrows show price reduction. Pretomanid was launched first in late 2019, but in December 2022, there was a 34% reduction on the price of Pretomanid. And then afterward, there were a couple of small reductions, and recently there was a 25% reduction further, with a third manufacturer coming into the market. So while Pretomanid started pretty low at $364 for a treatment. It's down to 169 already. It's the fastest price erosion or reduction we have seen in recent times. Um, but what does that mean uh, to all of us, really, who care about ending TB, about making really innovations, making an impact on health? So we tried to estimate what is the impact of PPAL today and what's going to be. And again, this itself can be a very long topic, but I'll just speak about what we are doing today, how it will impact us over the coming few years. So over the next 10 years, we estimate that BPAL-M implementation will result in more than 300,000 incremental or additional treatment successes. It should save close to 180,000 lives, avert nearly 5 million DALIs, which means disability adjusted life years. That's the years that one lives in poor health or premature death, imperfect health. You're saving 5 million of those life years. We found that the simplification of treatment, making it all oral, reducing the time frame, um, contributes as much as half of the success rate. So half of it is because of the drugs work better, they are more patent, they cure better. There's certainty of success of treatment, but 50% is because it's simpler. That means people don't have to keep going back to the clinic for a year or for 18 months. They just go for a few months of follow-up and they're done. uh, that makes it a lot more successful, which was really very heartening to see. And that is really informing future direction in the field, that every month you reduce on treatment is going to help. So today you are at 6 months. If you come up with 3 months or 4 months of treatment, that's going to help. That'll add impact. If you come down to a month, that'll be huge. And end of the day, what does it mean to the donors who are really driving our field? Is it'll result in $1.2 billion in savings. That means there's more money available to invest in other health uh, activities, including in the field of TB, in field of DSTB. It could mean more support to the communities and to the patients if you can save money on drugs and on follow-up costs. So that's what I wanted to share mainly with you. I also wanted to share with you that um, uh, developing new treatments is only part of the solution. Ensuring that they need people is really um, uh, what's critical. And for that reason, TB Alliance, along with its partners, is working deeply in the field where the need is. And over the last 3 or 4 years, starting from zero, we have expanded our efforts, working on the ground with local partners, with communities in a range of countries. And this slide is just a representation of where we have direct projects. Several of them, we have community-oriented projects, and we look at continue to grow that.